Hello, I'm Colleen Gallagher, CEO at Onward and Upward, and you're listening to the Association Insights podcast, where each week we interview association leaders from across the country to hear how they're trying new things, taking big risks, and delivering value for their members. We'll explore the realities of what it means to work in and with associations and bring you the insights and inspiration you need to advance your career and make big changes at your association. Let's get started.
Welcome back to the Association Insights podcast. I'm your host, Meghan Henning, and today I'm joined by Marilena Vrana, Vice President, Public Affairs and EU Operations for the Plasma Protein Therapeutics Association. A longtime Brussels-based health policy leader, Marilena brings deep expertise in advocacy, patient engagement, and EU regulatory strategy. At PPTA, she leads efforts to advance policies that support safe plasma collection and equitable access to life-saving therapies across Europe. Welcome, Marilena.
Thank you, Meghan. I'm thrilled to be with you.
We're happy to have you here today. So let's start with the big picture. Your role places you right at the intersection of European and American trade policy, which is such a dynamic space right now. How do you and your leadership team ensure PPTA Europe stays relevant and forward-looking amid all the rapid policy and tech changes on both sides of the Atlantic?
Well, today, the pace of change across Europe and the US is indeed, as you said, intense. So staying aligned as a team on both sides of the Atlantic is very important. Sharing information quickly, keeping our messaging consistent. These are two things that we really focus on. Equally important is staying very close to our members, our partners, patient groups, and other stakeholders to really understand what's coming our way, where the pressure points really are. We don't just react to policy changes. We try to anticipate them. A good example from Europe on this point is the newly adopted European legislation on substances of human origin. We saw it early on. We saw that it would affect plasma collection, and we had to seize it as an opportunity. So we mobilized very early in the process, prepared with our members, built evidence-based positions, and became a trusted expert voice in that legislative process. That's what our members count on, not just in PPTA, but in any association. Being ahead of risks, shaping policy early, and being the expert voice the decision makers trust.
I think that's so smart. And do you feel that, for other associations out there listening, is it, you mentioned policymakers and regulators and your members and keeping in constant touch, right, and communication with them. Are there any even tips that you would say out there that are working for you in that type of listening and communicating that others might be able to help with?
Yes. Well, it's important to really keep your contacts close and listen to them actively. Try to understand what they're going through. Also, we talk about regulators and legislators. These are also people who have to do things, not necessarily because they really want to and they really also feel it's the right time, but they really have to follow a political line that is coming their way. And they equally struggle as we do. So maintaining that human approach and contact with them, showing understanding and listen what they are really trying to do, politely explain your point of view, trying to accommodate what they have to actually deliver is helpful, I think.
I think that's important. And especially because you're in Europe and for global associations with headquarters and offices in different places, in your experience, what cultural or professional differences between European and American colleagues and stakeholders most impact collaboration? And how have you successfully navigated those differences?
We are lucky to have a diverse, qualified team in both Europe and the United States. Cultural differences could be challenging at times. I won't say they're not, but I'm a strong believer that diversity is one of our greatest strengths. Diversity here in Europe is the norm in European politics. Policymaking here means building consensus across 27 member states. Each one of those has its own language, own culture, a different legal system, their own healthcare system, and their own political priorities that they have to cope with. In the US, things often move faster. There's more homogeneous, I would say, environment. To navigate that, we focus on respecting the different perspectives, stay open, and communicate clearly to everyone so that everyone understands within Europe and between Europe and the US, understand these national nuances that are important and adapt our approach, our working approach to that. And we also learn from each other. There are things in the US that they move faster, or here in Europe, there might be nice examples that could be transferred. Having the opportunity to discuss those solutions and adapt them to fit its political or cultural context is a big asset. At the end of the day, we all work on the same mission, ensuring patients globally have access to life-saving plasma-derived medicines. That mission always keeps us aligned.
I think that's great. And you bring up such a good point. You have so many different countries, different languages, different legal systems. I hadn't even actually thought of that. And then different healthcare, which would be very challenging. So I love that answer, because I think for our listeners who do have a global footprint in their association, that's just something really to remember. And again, just the diversity of it and how that works. It works in everyone's favor. And I think that's a great point.
I agree.
So what are the top priorities or initiatives for PPTA Europe that you're going to focus on over the next year to strengthen your global impact?
Our priorities are really clear, and they tie into our 3-year global strategy. They also keep Europe's unique challenges and opportunities in mind. So for 2025 and the 2026, we are focusing on 3 things. First, raising awareness on plasma-derived medicines. These medicines are unique and life-saving therapies made from human plasma, and you cannot make plasma in a lab. They rely on donations from healthy individuals, and often the patients who need them have no alternatives. So it's vital that policymakers and the wider public understand just how unique and valuable they are. Number 2, we are making sure that policy and regulatory frameworks actually work in practice. And they will work not just for patients, but also for the donors who make these medicines possible. And lastly, building trust and credibility. We do that by sharing evidence about donor and patient safety and highlighting the incredibly high regulatory and voluntary standards that our industry follows. And we don't do this alone. Collaboration is very important. So we work closely with patients, with clinicians, and partners, because when policymakers hear one clear and unified message, that's very powerful. At the end of the day, irrespective of the sector that we represent, we all care about the same thing. Make sure that people who need those medicines have access to those at the right time.
I think that is so important, especially because you are dealing with life-saving, um, subjects, and this type of communication and getting that message out would have to be so very clear. And I liked when you said there's the regulations, but then there's your own guidelines, and I think that's super important. So, in what ways do you think PPTA is a model for other global associations?
That's a great question. Thank you for that. Our sector is pretty unique because, as I mentioned before, every plasma-derived medicine starts with a human being, with a human donor. There's simply no synthetic alternative to that starting material. Human plasma is a critical starting material for life-saving therapies, and that makes both our industry and PPTA unique from the outset. We're also unique in the fact that as an association, we really represent the actors across the value chain from collection to the product entering into the market. So going back to your question, what makes PPTA a model is how we've grown and evolved to deliver our mission on saving lives. 30 years ago, the industry wasn't as united as it is today. We started as separate associations in Europe and North America, manufacturers talking within their own groupings, collectors talking within their own grouping, and bringing all of those voices into one global voice was a big milestone in 2002. Now we've got a global strategy that translates into clear, agile, regional work plans. So whether it's Brussels, it's Washington, or anywhere else in the world, we all work as one team around the same goals. Our agility has really matters in critical moments. For example, during the COVID-19 pandemic, when donations dropped and borders were closed. And even now, as you say, we face trade tensions, and that agility is really important. So now PPTA, in PPTA, we are able to respond quickly, stay coordinated, and always keep patient access and donor well-being front and center in our work. For me, that's why PPTA is a model, because of our collaboration, our agility, and our people-centered focus.
I think that's some great advice for our other global association listeners, because sometimes I feel like when you're thinking about something like this, it seems daunting, right? How do you get all of these people to agree, right? And
yes,
it sounds like you have done that. And it's being agile, as you said, and the communication. So I think that's really important. A long time ago, I worked for an association, and it was global. And we sort of had the same thing. We had a few different places, but it was very challenging to get, everyone on the same page.
It's not easy. It's not easy, for sure.
And now,
but it's worthwhile to go through the process.
I think so. I think, we went through the growing pain to get there, and we did achieve it, but it was hard. But I like the fact that, you having this strategic plan and communicating, it just makes people feel included and then heard, which I feel like is the secret to get along.
It helps unite the team and understand where your daily work really fits in the bigger picture. It's motivational as well for people.
I think that's great. So what lessons from your own leadership journey would you share with peers who are trying to grow in their association career?
We all know there are no two leadership journeys that are the same. So it's a really important question. For me, resilience is the key to growth. Being resilient helps me get comfortable with uncertainty, stay focused on the mission, pivot quickly when things change, and having my team's back when the journey gets tough, and the journey will get tough at times. I've learned that lesson early in my personal life. So I'm a patient myself. I had my first epileptic episode when I was 8 years old, and I went through a long, uncertain journey before I finally got a diagnosis and treatment in my teens. So living through that taught me that I have to manage my own anxiety and how to manage it, be somewhat comfortable in uncertainty, and adapt when there are more questions than answers. This is something I carry into my professional life and leadership every day. Another big lesson is authenticity. Early in my professional career, I often held back the true Marilena, my daily me, my true self, because I was worried that if I would show emotion, especially as a woman, it might be perceived as weakness. Speaking up in front of a big group with senior management, it might not be appropriate at times. So over time, I realized that authenticity is a great strength. And when you bring your full self to work, your voice, your emotion, your perspective, you build trust, you inspire others, and you create that space for them to do the same. And finally, empathy. Leadership is more about people than is, and it's not just processes. I mean, yes, processes are equally important, but being around people and managing people is very important. So empathy means listening deeply of what your colleagues are saying, what others are saying, understand the different perspectives, and show respect even when you disagree. Find constructive ways to show feedback while remaining respectful. It's what helps build stronger teams and deeper relationships with stakeholders. So if I had one message, it would be this: be resilient, be authentic, and lead with empathy. These are qualities that don't just make you a better leader, they make you a better colleague and a better human being.
I think I have done so many podcasts, but this has got to be the most inspirational answer that I have ever heard. I mean that. That is,
Happy to hear.
I have a 13-year-old daughter, and I talk about resiliency all the time because I think it's hard to teach, right? To the grit of getting back up and, falling down, getting back up. And I love the authenticity because I do think as women, we hide a lot of it. You don't want to be upset or look like you have any feelings or, and I think that is very hard. And then of course, empathy. My goodness, we live in a world that requires, I feel like, a lot of empathy at the current moment. So this, honestly, this is what an inspirational response. So thank you for that. We wrap up every podcast with a few fun questions, just so our audience can get to know you. So one, this will be great because you are based in Europe, so I would love to hear this answer. Have you gone anywhere fun lately?
I'm actually right now working from my home country, Greece. So I am already somewhere really fun. If you have not visited Greece, I would definitely recommend it. I would strongly recommend it. If you are a mountain person, we have that island beaches, all kinds of weather. It's fun to be here.
Oh, that's so nice. That is on my bucket list. Plus, I think the food is delicious.
Oh, yeah.
Yeah, so good.
I won't argue that. Yeah.
So are you listening to any podcasts that you might recommend to our listeners?
Even though there's limited time in the day, I often listen to Freakonomics. It gives me a fresh perspective, and the discussions are so lively and engaging. So I love that.
That's a great one. Yes. What's one place that you would love to go, like on your bucket list in terms of travel?
In general?
In general, normally
in
we ask
general.
it about the
Yeah.
US, but you are sitting in a perfect paradise. So I will ask for.
Yeah. Oh, there are many places in the world that I would love to go, and there are many places in the US I'd like to visit. I often come for work, so I don't have a lot of time to really see those places. But there's a big trip in the bucket list that my husband and I have, and that's a coast to coast road trip in the US from west to east. That's something that we should definitely do.
That sounds very fun. And our final question is, finish the sentence. When you see me looking at my phone, it probably means that I'm.
Well, if it's a weekday, if it's during the week, I'm probably checking work emails or checking the news, or I'm maybe checking if my kids are home and they need something. But over the weekend, it's usually me chatting with my girls, my childhood friends. We have a lively group, keep on going over the years, or I may be shopping. I must admit that I do that too.
I love it. I love it. Well, this was such a wonderful conversation. I'm so happy that we got a chance to talk to you. And again, your last, question or your last answer was really inspirational. So I appreciate that.
Thank you, Meghan.
Thank you so much.
It was a pleasure meeting you. Thank you for inviting me.
Nice meeting you.
Bye.
That's a wrap for today's episode. The Association Insights podcast, previously known as the Association 100 podcast, is a production of Onward and Upward Marketing and Communications, where our mission is to make associations and nonprofits the go-to source in their industries through earned media and thought leadership. This podcast is an extension of our newsletter, a bi-monthly collection of best practices, top trends, helpful ideas, and smart strategies delivered straight to your inbox. Have you undertaken a big change at your association? Or do you have some words of wisdom from the trenches of association life? We want to hear from you, and so do our listeners. Drop us a note at info@onwardupward.com. That's info@onwrdupwrd.com. Be sure to subscribe, give us a 5-star review, and share with your friends and colleagues. We're available anywhere podcasts are found. Come back next week for more association insights and inspiration. Thanks for tuning in.